Have you ever really stopped to think about how a tiny pill can create such huge changes in the body? It's pretty amazing. Well, today, we're going to unlock the secrets of that entire journey. Welcome to The Explainer. We're about to break down all the essentials of pharmacokinetics and medication administration so you can build a really solid foundation for your clinical practice. Okay, so here's our game plan. Think of this as your personal study guide. We're going to walk through everything step by step, starting with a core theory of what the body actually does to a drug, and take it all the way to how you apply this stuff in the real world. All right, first things first. Before we can go anywhere else, we have to define our main concept. This is going to set the stage for absolutely everything that follows. So, pharmacokinetics, what is it? Here's the big idea. It's the complete story of a medication's journey, from the second it enters the body to the second it leaves. In other words, it's all about what the body does to the drug.
Now, this whole journey isn't just one big blur. It's actually broken down into 4 really critical stages. You've probably heard the acronym before, ADME. This is basically our roadmap for the whole process.
And here they are. This gives you that perfect visual of the path it takes. See? It's a straight shot. First, the drug gets absorbed. Then, it's distributed around the body. After that, it's metabolized. And finally, it gets excreted. Let's dive into each one. Okay, step 1, absorption. This is all about getting in the door, right? It's how the medication gets from wherever you put it, in your mouth, in a muscle, on your skin, and into your bloodstream so it can actually start doing something. Now, this is where it gets super interesting. Check out how much the route matters. If you look at intravenous or IV, boom, no barriers. It's in there 100% right away. That's why IV meds work so incredibly fast. Now compare that to a regular oral pill. It's got this whole obstacle course to run through the GI tract, and it's affected by food, pH, other meds, you name it. That's why its absorption is so much more variable. All right, so the drug is in the bloodstream, now what? Well, it needs to get to where it's going, and that's distribution. Seriously, you can think of it like the body's own delivery service, getting that important package to the right address. So a few things can affect this delivery. First, your circulation. If blood flow is bad, delivery is going to be slow. Simple. Second, can the drug actually get through membranes? Some are lipid-soluble, meaning they can slip right through barriers like the blood-brain barrier. And third, and this one is super important, is plasma protein binding. Imagine proteins in your blood, like albumin, are kind of like carpools. As long as the drug is riding in the carpool, it's inactive. Only the free drug, the part that gets out of the car, can actually do its job. Next up, we have metabolism. You can think of this as the body's chemical workshop, or its processing plant. This is where enzymes, mostly chillin in the liver, get to work and chemically change the medication, usually to get it ready for removal. Now, a bunch of things can tweak this process. Age is a big one, but let's talk about the famous first pass effect. This is huge for any drug you take by mouth. After it's absorbed, it goes straight to the liver, and the liver gets the first pass at it, and it can actually inactivate a large portion of that drug before it even gets to the rest of the body. And the final stop on our journey, excretion. This is simply how the body gets rid of the drug, and the kidneys are these star players here. This is exactly why, in a clinical setting, we are always checking a patient's kidney function with labs like BUN and creatinine. If the kidneys aren't working well, that drug can't get out, it builds up, and can reach toxic levels, which is a massive safety concern. So now that we've followed the drug's entire journey, let's talk about how we measure its effects. How do we make sure it's not only effective, but also safe? This is where all that science really connects with patient safety. Okay, this concept, the therapeutic index, or TI, is absolutely critical for keeping patients safe. A drug with a high TI has a really wide safety margin. A little too much, a little too little, it's generally okay. But a drug with a low TI, whoa, that's a super narrow window between a dose that helps and a dose that harms. These are the drugs that need really close monitoring. All right, let's put that to the test with an NCLEX-style question. A prescription comes in to get a trough level of your client's medication. What do? Take a second, think about it. The trough is the lowest concentration of the drug. It's the bottom of the valley. So you'd want to draw that blood sample immediately before giving the next dose. The answer is A. That tells you just how low the level has dropped. Next, let's talk about half-life. Now, this sounds kind of technical, but the concept is really simple. It's just the amount of time it takes for the drug in the body to drop by 50%. By half. That's it. And this is what tells us how often we need to give a drug to keep it at a steady, effective level in the body. So let's apply that idea. Let's say a drug has a really long half-life, like 4 days. How often do you think you're going to give that medication? Yep, you got it. The answer's A. It's usually given just once a day because it sticks around in the body for a very long time. See how it all connects? All right, enough with the theory for a minute. Let's get into the practical side of things. We're going to review the key nursing actions and patient teaching for a few different ways we give meds. This is where the rubber meets the road. Okay, eye drops. Seems basic, right? But doing it correctly is so important. I want you to pay special attention to step 4, applying gentle pressure to that inner corner of the eye, the nasolacrimal duct. That simple little move prevents the medication from draining into the nasal cavity and getting absorbed by the rest of the body, which could cause all kinds of unwanted side effects. And what about an inhaler with a spacer? Well, that spacer is an absolute game changer. It holds the puff of medication in that little chamber, which means the patient doesn't have to perfectly time their breath. It allows them to take a slow, deep breath and get much more of that medication deep down into the lungs where it needs to work, instead of just having it hit the back of their throat. And for injections, these are your non-negotiables, your absolute rules for safety. You have to know your sites. Ventrogluteal for larger volumes, vastus lateralis for infants. You must choose the right needle size. And remember, the deltoid is a small muscle, never more than 1 ml of fluid. And the Z-Track method. That's your best friend for any medication that can irritate the skin. It basically seals the medicine deep in the muscle. Okay, let's take a deep breath. We have covered a ton of ground. Now, let's pull all these concepts together and focus them into some key takeaways that will help you ace your exams and, more importantly, practice safely. Here they are, your memory anchors. Burn these into your brain. ADME. Low TI means high risk. The first pass effect is like a liver tax on oral meds, which means an oral dose often needs to be much higher than an IV dose to get the same effect. Kidneys and liver are your key players. If they're not working well, toxicity risk goes way up. And never ever forget that teaching your patient the right way to take their meds is a critical safety intervention. And let's end with the clinical judgment challenge. Your patient has severe liver disease. We know the liver is the main place for metabolism, and their new prescription is for a drug that is heavily metabolized by the liver. What's your priority action? What do you do next? With a compromised liver, they can't break down the drug properly, and the risk for toxicity is through the roof. Think about it. Thanks so much for joining me, and I'll see you in the next Explain.